So, so it's basically just like you would think about, raising a child as you raise somebody who's fighting the fight, or, who has been treated previously. You want to help them gain responsibility, for themselves. And that's what the transition of care, really means to me. As far as when that process starts to occur, again, I think it's very individual. I think it depends a lot upon the maturity level of the adolescent patient. Certainly, it's very dependent upon any ramifications of their therapy that may affect cognitive function. I think that's certainly an important consideration. But really, I think it starts, I think, in any teenage patient, at the time that they're diagnosed. I think you really need to start having these conversations about giving them responsibility for pieces of their care, maybe not all of it, right? If you have a 14 or 15-year-old, they're going through a ton of things. You may just want to throw them a pill bottle and say, here, have at it. But, I do think it's incredibly important to make sure that they're a part of the conversation. One thing that we see is, a lot of times, particularly in that early transitional age, 14, 15, 16, when we talk to patients, they shut down a little bit, perhaps after a period of time. But it's important to really kind of meet them where they're at, to get them engaged, and start to have them think about these things early on, and then as they continue to mature, work with your healthcare team to help facilitate them taking responsibility. But I'd love to hear from the panelists. What did you find was helpful from your parents, from your treatment team? How did you, what kind of helped you take those steps?
So that actually brings us to our next question is, how do you prepare yourself or your teen for this transition? So, Molly, Bunny, do either of you have any preliminary thoughts on that as you're currently going through it?
Yeah, I can go, Mom. Is that okay? I completely agree. I think that it's such an individualized process. It totally depends on like the mental health and where you are physically when you're going to start transitioning. Like for me, I was diagnosed when I was 18. I was so excited to start being more independent. And I was so excited to finally like go to college and become my own person and meet new friends. And sadly that just isn't how it went for me. So it was a very difficult thing that my family and I, not just my mom and I, but my family as a whole, had to sit down and talk about what are things that I need, what are things that aren't helping me, how can I, become more independent, but also realize that my circumstances are so much different than everyone my age, and I do need that extra little bit of help. And it was really important to me too, once I started going to college and meeting new people, that I set boundaries for myself. You have to learn how to say no. And you do just have to have that individualized kind of talk with your family and with your caregivers and say, you know what, I need help in these areas, but in these areas I need you to give me a little bit of freedom too. Which is something my mom and I are still working on 2 years later. It's a hard thing to do. And like I said, circumstances are so different. So every person is just so individualized, and every situation will never be the same.
I think you go from having a kid that is under 17 and the doctors speak to you. The doctors speak to the parents. And the day they turn 18, it is a curtain down on the parents, and it switches to, could you leave the room because we need to ask Molly something. It is something that you need to talk to your team ahead of time. I think for us, she was diagnosed after she turned 18 by 2 weeks. If you have a 15, 16, 17-year-old, it's time to have the conversation now before you turn 18, because there's paperwork, there's people to talk to. It's not just your doctor, it's your social worker, it's everybody that sees you. It's your college. When you turn 18, it's all of a sudden people think that they can handle everything on their own when they hadn't for the last 18 years of their lives.
That is such a good point, Bunny and Molly, that, there is that you guys have to try to figure out, just like every family does, how much independence are we going to have? But then you add that diagnosis on top that people don't normally go through alone or don't normally handle on their own. And so you do have to find that autonomy of, okay, what are we going to do as a family? What makes sense? But then also, Bunny, as you're saying, that was one of the things that even I learned is, all of a sudden we can no longer sign paperwork for our children. We no longer have the right to hear everything that is being said in those meetings. We no longer are the person that gets all the calls. And that can be really scary. And also, if you're not prepared in advance, when you go in, that might be a shocking meeting too, when you're expecting to get your child's results and all of a sudden you can't get them. And so I think that's a wonderful point that you're saying, start a couple years early. You know what I mean? Figure that out. Ask your team what that's going to look like. And I also want to say vice versa. I had a prior conversation with Whitney, who's on the call, where she also was trying to find that independence. And you made a comment to me that even going as a young adult, sometimes you notice that the doctor still would look at your parent in the meeting. And can you explain a little bit about that?
Yeah, so I was diagnosed when I was 10. So my whole treatment, I was obviously aware of what was going on, but not to the extent that an 18-year-old would be or would want to be. And so even if I go to 2 years ago, I went to a follow-up appointment and my mom came with me. And the doctor didn't even look at me when he was talking to me. He was looking directly at her the whole time. And she kept saying, talk to her, talk to her. But I think that even my experience of that transition to adulthood, I wasn't an active cancer patient. I was in survivorship clinics and in, tons of specialty appointments for years before I was 18. And then once I turned 18, it was almost a shock for me as well, where it was like, okay, so how do I handle this? What kind of information do I need to know? Having a copy of whatever your treatment plan was is super important because I have no idea what the dosages were and all of that. And so when you get into survivorship, there's so many more things that it's important to be empowered as a young adult and in that transition to ask questions and know what you might need or what you don't know when you have to transition. I moved out of state, so I'm not from Ohio, but now I live here. So I had to find everything I needed to bring to Ohio with me so I could get whatever kinds of resources and support I needed here. And that's a big part of what I do in my work as well, is I work with patients who are 15 and up and trying to start to help guide them in building that independence, because so often as patients, we rely very heavily on our support system and our parents. And so finding ways to start to make that transition where, oh, you know what, if I can't make this appointment, I can make that phone call. That's an easy, low-hanging fruit type of thing to do. So working to help build that sense of, I guess, strength and, your ability to take on some pieces, and exactly what Molly said, having these conversations as a whole family of what is important for me to take on my own and what types of things are important or that I would like to still have help and support with.
I think from a clinician perspective, one thing I was thinking is I think it's really important to make sure, if you're dealing with an adolescent on active treatment, that you carve out a piece of the time that they're there where you ask the parents to leave and kind of do that on a regular basis. So it's not so unusual, kind of normalize that experience. And a lot of times, trust me, I'm not perfect at doing this, but a lot of times, it'll be very brief and short conversations, but at least it kind of, they gain experience for talking one-on-one. They are allowed to ask the questions that they want to ask, which may not always be comfortable being asked in front of their parents. And I think much above the age of 14 or 15, I think that really should be a part of the AYA cancer experience. But Whitney, the survivorship piece is really critical, and is obviously that's probably not something we think about enough. Helping patients we don't see on a regular basis understand their treatment, and really just making that an important piece of their maturation process. So thank you.
I think that's a wonderful. I just wanted to show both of those sides, because I feel like there is that balance, and every team and every family has to figure it out amongst themselves. But I think it starts with those providers really kind of nudging and helping, and our providers do know us. They see us, and so knowing when is a good time. But I feel like that age, a couple years out, is perfect to start. Baby steps, as Dr. Yeager's saying, is slowly working so that it's not such a flip of a switch. But also, from parents, you're kind of limbering us in too, of giving up some of that control that, Bunny was talking about. Like, I'm already dreading it. My daughter's only 6, but I'm already like, what's going to happen when I can't, this is my world. And so it is really hard, as mama bears and daddy bears and family bears. We want to protect, especially when our kids are up against these hard things. And so really using that balance. And our next question is, how do I myself as a patient stay on track, or how do I help my teen stay on track? And when an individual asked this question, they were not only talking about the medical side, and the example they gave was they are having a really hard time having their teen remember to take their medications, to show up at the clinic appointments, to get all the information. Sometimes they might come home and mom or dad is like, okay, what did they say? And the kid's like, and it's hard, because you almost do need multiple people in a room, because you all take in different information, and especially if it's heavy information, that can be hard. But also, I wanted to start with Roya here, is that family member also asked schooling, college, jobs, higher education. Their kid doesn't want to take off work to go to their clinic appointment. They don't want to have that conversation with their employer. Sometimes they don't want their employer to even know that, hey, I'm a cancer survivor. Or their college. They don't want people to know, in class, in school, because maybe they haven't had that conversation. So, what are some things that you work with families when it comes to being in the community, being at school, being in a job? Are there any tips or tricks to help families in those rooms, Roya?
Hi. So a lot of times it's about starting that conversation with them about being comfortable with that. And so there are benefits to disclosing, and honestly, it's really going to depend on somebody's comfortability. And so when we're talking about getting reasonable accommodations to around school and work, you have to have that conversation with an employer or that school entity. And so a lot of times what we do from the vocational rehabilitation side is that we will sit down with them, maybe do some mock interviewing about how to approach that conversation, talk about the benefits to it and what you're actually asking for. So making sure that, you don't have to tell them everything, but like you need to express what it is that you feel like you need as far as in terms of accommodations. And so a lot of times it's identifying what that is, identifying what those limitations may be, identifying what those accommodations you actually need, and being comfortable with having that conversation. Again, being comfortable having uncomfortable conversations. And so it's basically getting used to having that and being okay with that. And it doesn't mean that there's a mark against you or it's a necessary bad thing. It's just to recognize that you might have to do things a little differently, and that's okay. And so when we work specifically, like especially with transition youth, we start having those conversations with them early, starting to get them the exposure about how to have those conversations. We kind of build that into some of our, what we call our skills to pay the bills. And so that's kind of their life skills that we kind of work with them to kind of build upon it, to get ready to start having those conversations once they transition out into the world.
Thank you, Roya. And is there any other tips as far as with Dr. Rager, Winnie, Molly Bunny? Is there any tips for helping teens, remember to stay on schedule for their meds or to show up those appointments? I know, they just want to be a teen. They just want to be a young adult. They want to go to college. They want to go to their job. They want to go out with their friends. And so, are there any things that you recommend or tips or advice?
I will tell you that I thought that I was helping Molly by putting all the pills in the pill box for her. I thought by doing for her, I was doing her a service. And in hindsight, it was definitely a disservice because she couldn't do it herself when she was gone. We literally had to take pictures of what the pills looked like so she could do that, which if I would have included her in this process in the beginning, she would have had a better grasp to do it herself, which ultimately is what you want to do when they're 18 and above as much as they possibly can. Taking things off their plate in the beginning might not be it might be the easiest way. It might not be the smartest way.
Yeah, I will say too, being any age and having cancer is absolutely exhausting. But when you do kind of become this age where you're starting to try and become more independent and you're going to school and you have your friends and you can drive and you have all these things and you want to get a job, it's just a lot. It's a lot. But something that I really had to sit down and tell myself over and over again and really kind of drill into my head is I have these circumstances that most people will never ever have to deal with. So some kids get to go to soccer practice. You have to go to therapy. You have to learn which pills you need to take, and you can't. I don't want to take my pills. It's like I don't want to wake up every day and take my medicine. Like I want to go to school and just be normal. But we're not normal kids anymore. And there is no normal for us anymore. And that's something that you just have to kind of to navigate, and it takes time, and it's been 2 years for me and I'm still learning that. But like my mom said, being involved with the process, as exhausting and as tiring and draining as it is really helpful for once you do have to kind of be on your own. Like I'm 8 hours away from home. I called my mom 2 days ago crying, saying, Mom, I just want, like, I need a mom hug. Like I need you to be here. I'm not doing well. And sadly she can't. She has a job too. And I have 2 sisters and I need to be able to learn to do those things by myself. And so being involved with the process from the start, at the start feels like too much too soon, but as time goes on, it is really helpful for the long term.
And just to jump back in there, because you made a bunch of good points, and so I know, like with us, we have what we call our pre-employment transition services, or PREETs, and so one of those focuses is instruction and self-advocacy, and so that is specifically designed to kind of work on those things, how to advocate for yourself, how to self-manage yourself. And so we have services that are specifically designed to kind of help students with ages 14 to not yet 22, that kind of help them navigate that system and how to use those skills in transitioning out to the world. So we call them PREETs because they're pre-employment transition services, because before you get out into the world, there's some things you could work on. And so we have those services that are specifically designed for those students making that transition to kind of help along with those things as well.
Yeah, and I love what Bunny said and Molly reiterated, in terms of really early on, just having them start to take responsibility for their care. It's really critical. I kind of feel like there's 2 levels, right? There's the perhaps maturing person who's just forgetting and not prioritizing, and I think that's where again, you need to rope them in early, have them understand why they're taking what they're taking. Really, I think increasing knowledge can be helpful. There are apps out there now in terms of like pill taking that can really be a good reminder. But that's where a lot of, I think, educating and really kind of working with them on an individual level can make such a difference. There's another level too, though, right? There's the adolescent who's angry and really, it's more of a rebellion thing, and that's a tougher pill to swallow. I don't mean to be punny, but that's a tougher situation to negotiate. And I think it's very normal. You know, I have a very healthy 15-year-old son who's angry at me all the time and doesn't want to do anything. So, you know, I can't imagine dealing with this at that time of life. But it's really important in those situations, I think, to work with your psychosocial team, really understand where they're coming from, you know, try to do your best to make an alliance. It's tough. I mean, I'm sure Bunny could and Molly could tell us it's really difficult to negotiate these situations in a healthy way all the time. And so I wish I had a one size fits all answer for that one. That I think takes a little bit more depth of understanding of the individual patient and what they need, and then working with your psychosocial team to really understand, you know, what's out there and, you know, how you can help change behaviors. But
yeah, and like Dr. Yeager just said, I mean, like, I get mad at my mom all the time. I'm like, stop telling me to take my medicine. Like, I am 20 years old. I know what I'm doing. But sometimes that reminder and that little extra like push of, hey, I just really care about you. I don't want you to go into a seizure. I want to make sure that your brain isn't swelling, like those types of things, like as frustrating and as sometimes honestly like degrading in a way, like it's necessary. And I know my mom cares about me, and I know she wants the best for me, and I know that my doctors wouldn't give me these medications if I didn't have to take them. But and I do agree that for a while I did have this rebellion thing. I was like, I'm 20 years old, I'm not taking these medications, like it's fine. I'm not going to take an Alzheimer med, like it's fine. I'm not at that point yet. But when you're diagnosed with cancer, you're at that point. You need to take your medication. You need that extra push sometimes, and it comes from a place of love and not from a place of I'm trying to control you. So that's also just a mental thing that talk to your therapist. Therapy's cool.
I think also when you're a parent and for 18 years you're used to being the person that's telling them what they need to do, and you need to take a step back when a child has cancer to listen more, because this is their world and we're living in it. It changes things. This is their life. Obviously you're a parent and you care what's going on, but they automatically get more of a vote, I think, or they should, once their health in any kind of chronic illness scenario. We need to just remember that as parents, and as hard as it is because we want the best for them, we need to do this together.
Those are all such wonderful points, and I feel like it's things that, you know, a lot of families, a lot of normal families go through too, you know, it's when do you start letting them do this and that? But as Bunny, you know, you pointed out, you have that additional layer, and sometimes because they have this diagnosis, you almost need to give a little bit more, you know what I mean, of that independence, and really understand. And I say this all the time, and I know it's not, you know, there are a lot of latent effects that sometimes mess with this and cause this to be different in your family, but I often say that the emotional toll these kids go through, and I say kids, and I know that is not the proper term, teens, adults, infants, everybody that goes through that has been diagnosed with this cancer, I often say they're wise beyond their years. There is so much that comes with these individuals going through as much as they have, and that often a lot of them have had to grow up way faster. You know, I often say my 6-year-old acts like a 16-year-old, and a lot of that is sass, but it is sass that she's gained from telling nurses and doctors, no. No, thank you. No. And often that no is not good because there are things we need to do. But she found her voice at 2 while, you know, going through treatments and things and surgeries. And so, um, being proud of sometimes that voice too as parents, you know, we don't want to diminish that voice. We want to say yes, you know, and so I think that's also a really hard struggle that you guys are getting at. But I do want to ask for those families that have written in and said, you know, my teen has treatment-induced cognitive issues now, treatment-induced disabilities now. There are things that I envisioned for my teen. I envision them to be able to go to college. I envision them to be able to become whatever they wanted. And now, because of their cancer, it has gone to this, you know? And so is there anything that you can say to those families that maybe they're not able to give their teen that level of independence because of the treatment-induced cognitive issues or disability? You know, we know there's limb loss, there's heart failure, there's liver damage, there's hearing loss, there's memory loss. The list goes on and on and on, and sometimes even debilitating PTSD and anxiety. So how do we walk that line? And I think you guys mentioned every family is different, but are there any techniques or tips to help those families that are often suffering with those extreme latent effects during this transition time?
Well, I guess I can start. I think, again, it really is very dependent upon, what the specific limitation that you're talking about. I think certainly from a cognitive standpoint, really early on advocating with the school system, and then into colleges to, one, get them tested and find out where they're at, find out, how you can put them in the best position to be successful. And, obviously it's a little easier in high school. College gets a little more dicey, but most colleges also will make accommodations based on what your strengths and weaknesses are. And then I think, certainly the work that Roya does and can really expound upon, I think really working with vocational counseling is critical, and helping, patients understand, what jobs, I deal with a lot of sarcoma patients, and so they've had amputations or they've had massive surgeries in their legs. And I had one patient come and say, well, you know what, I'm going to work as a security guard, walk in the floor for 8 hours. It's not a recipe for success, right? I mean, I think, helping them understand, and then think through, what their limitations are, and figuring out places to make them be successfit. But I'd love to hear from Roya on this one, and then obviously Whitney and the rest of the panelists.
So you hit a bunch of great points. So when it comes to colleges and specifically, most colleges have a disability services center. And so that anyone who's applying for college or going to be attending college can actually get registered with that disability services center. And they will make all the accommodations. They'll make sure that professors are aware of what accommodations need to be in the classrooms, as far as if students need to leave early, they need to be excused for arriving late. If there's different things, if they need to get things in a different format, if they have a reader, if they have someone who's going to take notes. So there's all kinds of, so getting linked with that disability services center at any college is essential to making sure that you have those accommodations. I know from the VR world, like we have a whole College to Careers program where we are actually embedded in the colleges around Ohio. So right now we only got 13, but we're still expanding. So we have a counselor who's actually embedded, who works directly with those students with disabilities, and to making sure they have the access they need, helping them to maybe arrange classes, helping them to kind of navigate that financial aid. So kind of help them with that piece while they're there on campus, because it does look different from when you're a student to transition into adult. And as we all know, college is a whole new thing. It's a whole new world. It's a very different path to navigate. And so we work specifically with them. We also have job coaches that can work one-on-one with them about navigating campus, how to get around, getting to understand what their schedule looks like, getting a better grasp of what the expectations are. And so, like, again, the biggest piece, and I think we touched on it a few times, is that making sure that we have that team in place, so they have the supports that are definitely needed. So if they have a counselor, social worker, parent, making sure the team's involved in helping to make that transition a little bit better, while still allowing for that person to do those things independently. Because the biggest goal is for independence, and so it's to making sure that we're fostering that while also helping them be able to advocate for themselves.
I think it's important to realize that there's a legal aspect to it too for schools. There's the FERPA, which is kind of like the HIPAA for colleges. So if you don't have that documentation in place, then they simply cannot talk to you. We know situations where kids have had medical issues, and you can call the the ER all you want. They won't answer you if you don't have this paperwork in place. So do yourself a favor and get that done before you need it, and just have it. It's important.
Whitney, it's short and sweet, so you can go too. Oh, you want to go? You jump in.
No. I was just going to second the FERPA because we definitely use that since we sometimes we do fund students that are in college, and so we make sure we're a part of that conversation and on that FERPA form, so we can have conversations as well with the schools as well. So it is a very important form to have once you get to college.
Yes, FERPA is definitely necessary. What I was gonna say, and I'll keep this short so Whitney can jump in too, but like long term, when you're talking about, like when we lose limbs or when we have memory loss and when we have all of those things like that, I mean, I deal with a lot of my own personal stuff in that regard, like memory loss and like issues with stamina. And I think something that I've had to really like kind of sit with myself and realize is like for long-term effects, I've had to be realistic about what I want to do with my life, and I've had to be really, really truthful in what I can and cannot do for my mental health, not only my physical health, but my mental health. So I've found other things that are still on the career path that I want to take, but also that I know I will be able to handle, because it's hard to look forward to wanting to do all these amazing things and knowing realistically, like, I probably will not be able to sustain this career. And so like something for me is, I'm a performer. I love to sing and dance and act, and I want to do that. But I know that sometimes I can't keep up with it. I can't keep up with my classmates all the time. And I do need to skip classes, and I do need to take breaks. So another thing that I've found a huge passion in through my cancer and through all the side effects is now I'm an advocate. And I can do that as a career too, while also still being able to perform. So there are things that you just kind of have to pick and choose your battles and find some balances and be accepting of the fact that, hey, there are other things that I love to do that I could do as a career too, that may be more realistic, but I can also do these other things I've been dreaming of since I was a little girl. You know what I mean? So it's just finding those balances and really being realistic with your goals.
And that's awesome. I know from the vocational standpoint of view, that's one thing we definitely do. We sit down and talk about what is it that you want to do, and we look at what your limitations and barriers may be to find a goal that's realistic, and that you can actually be successful in. So that is a real key to when we write plans for employment, is identifying an employment goal that can be sustainable. We've identified what services are needed and making sure it aligns with labor market. I used to, as a counselor, I used to give the example, like, well, we don't want to be a surfer in the middle of Ohio, kind of unrealistic in Ohio. So what can we do that fits within the labor market, that fits within, what are some of your limitations? What can we do that's going to help you sustain and something that you're going to enjoy at the same time, and kind of getting a better idea of what's going to fit you on all aspects. So I think that's good that you're aware of that and you kind of keep that in mind, because it is a hard thing. Some people are like, I want to be a doctor. It's like, well, what is it that you like? Do you like working with people? You like working, because there's a whole range of things you can do in the medical field. So maybe not a doctor, but maybe there's something else we can do that's comparable that will still, help fulfill that need. So that's definitely a big piece of the vocational, the career exploration piece that we do.
I think the only thing that I wanted to add to this is kind of jumping off of a couple of things that Molly said about having the realization that you're different, and that you have to make adjustments. And I think that takes a lot of time, and a lot of people need help getting there. And also, even for myself, I'm 24 years out, I have to remind myself that sometimes that, oh, I am going to be exhausted some days, and that's okay, and knowing that it's okay to ask for help. But I think the biggest takeaway for any families that I would recommend, and it kind of sums all of this up, is that the sooner you start communicating with your medical team, with the psychosocial team, and with other families and other patients and survivors, the better equipped you're going to be in all of these aspects. Because I have my adolescent young adult patients who have different workarounds for the way they do things. And who have certain apps on their phone that they love to take into the doctor's appointment so they can just record the conversation with the medical team permission and then send it to their parents so they know what's going on. But there's so many different pieces to this that the bigger you make your community, the more resources you're going to have. And I think that's the most important thing that you can do is start these conversations as early as possible.
Yeah, and the last thing that I'll say, because I really wanted to say this too, but I think that Whitney made so many great points, and everyone made so many great points. But another thing, like long term, I'm not really sure what the ratio is for like parents versus like teenagers or AYAs on this call, but it is really important too that, and I've had to communicate this with my mom, like just having a sense that like these people believe in me and I can do whatever career I want. I've been through this horrible, awful thing, and so much has been taken away from me, and I have had to grow up, but I can still be everything I want to be, even with these setbacks, and having that sense of like support and those constant reminders that like you're doing a good job, and like I do believe in you. And even if you think as a parent you're saying it a lot, say it more, because it's never a bad thing to hear I'm proud of you and I support you and believe in you. And my mom, not to kiss her butt, but she's done a really good job at that, which has been so helpful in my career path. So that is something as a parent that I would really encourage for your children.
I love that. Thank you so much. And Bunny, I just have to tell you, Bunny, you should be so proud of Molly. And Molly, you are so well spoken, and you are one of those kids that I say you are wise beyond your years. And it's truly, you know, before I know, you were an incredible individual, but I hope you know that you are even more incredible. And I'm so happy that you have decided to do this work in the advocacy space too, and be a voice for your peers, because that is so needed. And I'll stop because I could gush over you all day. Whitney, the same thing. You have overcome your battle, and to go back into this field, almost like to go back into that burning house, after you get out, you rushed back in. And now look at you. You're helping and guiding other teens and individuals to, get through what you barely got through. And I thank you for being in this field. And Dr. Yeager and Roya, I have the utmost respect for what you guys do. And Dr. Yeager, I gotta say, you are the name I hear so often in our pediatric cancer tribe of moms. We all love you and we respect you, and you've treated some of my dearest friends. So thank you. And Roya, I think the service that you give to these families, I hope, and I saw that Kim put in the chat the link to your guys' website, the service that you guys do. Please, families, I know it's really hard to label our kids with that disability term at times. I think that in itself can be a hurdle because it's almost ends up being an acquired disability through the treatments and the latent effects. But use those resources. They are there to help you. They meet you where you are, and they're not there to give you a title or to do this and that. They're literally just there to help and support. And we have an individual in the chat that said OOD has been amazing for her son. It's a complete game changer, helped him see his abilities. And that's what you do. And so thank you for her saying that, because that's where I was trying to get, is you just really help those kids and those parents discover what they have and what they're able to do. And it's just so wonderful. And Bunny, I know as a fellow cancer mom, you have been through it. And so I commend you. Not only the fact that you are, working to raise your 3 beautiful girls and support them and be there for them, and have to take this on from a distance as well and be there for them as they go out into the world. And be an advocate. I cannot tell you how powerful this panel of people are, and I am so glad that each of you decided to join us. I'm going to share my screen and show some resources here. And these are just some of a few resources that you will get in a big mega list here after the summit in a few days when we send out everything that we've got. These are some things that we have noticed are helpful to AYA. But again, we hope that you start this process younger with your teens. The OOD is in the chat as well. But I think it really, if you parents are looking for a first step here, it's ask your provider. You know, it doesn't matter how young they are, look to the future. It's a good thing to look to the future. And these are things we hope our kids get to. We hope our kids get to be in this transitioning phase. And so it's a good thing to look forward to and seeing how you can empower them. And I know I personally am going to even take steps with my little one to start empowering her to have a conversation with her doctor even. I tend to, when they come in the room, I have an amazing doctor, Dr. Roberts, and he is so wonderful at looking at my daughter and saying, "How are you?" And he talks to her. And often I'm like trying to like get in his line of sight because I'm like, I have all these things I want to tell you. But I appreciate it so much now because, as you guys are all saying, that's what she needs, and she needs to really be able to own that. And so, I will stop trying to get in the line of sight now, and I will let him do his thing with her. But I cherish those moments as well. And so, parents, I feel you. We have an internal struggle of wanting to keep our babies, and let them fly. Um, and here are some things on the screen, and I encourage any of the panelists, if there's something you want to call out, but here are some things that our pediatric cancer work group put together on some things for parents and families to do, for community members to do, and medical providers to do. Are any of these things resonating with our panel here? Is there anything you want to add?
I do want to say one thing, as Molly and Whitney speak so eloquently, because they are advocates and they've done this before, that as a new parent that might be diagnosed, to see them and be like, oh, my kid, we're not even close to being there. It took a long time to get here. And I want you to know where you're at is where you're at, and you're doing great. And reach out to friends, reach out to people who have been through this before, because I thought I could do this alone. She's my kid, I can handle it. And there are so many people out there that want to help. Let them envelope you in love. Let them help you, because just what they say is like, you know, on an airplane, when the mask comes down, the parents, you would think that you would put it on your kid first. No, you have to put it on yourself. You have to put the mask on yourself so you can help them. So make sure you have your oxygen mask on firmly, because that's the way you're going to be able to help your kid.
Yeah, and adding on to that, I wanted to say too, like something that has helped me a lot through my own journey, which I'm still very much processing every day. You know, I process this horrible thing that has happened to my family and I, but there is no timeline for healing, which is something that really frustrated me when I was first diagnosed, because I was like, why am I so angry? It's been so many months. Like, I finished treatment weeks ago. Why am I waking up so sad? And I really do think that, like, allowing yourself to have really bad days is still being really strong. Like, allowing yourself and recognizing the fact that, hey, today was harder than yesterday is healing and is taking steps forward, even though it feels sometimes like it might be taking steps back. As a teenager and as a young adult, like, or any time, no one should ever have to go through this. So, like, if you need a couple more weeks than you think you need to get over that one doctor appointment, like, you're still on track, you're still moving forward, you're still getting out of bed, and that's all that you can do. And so when it comes to these resources, like, just keeping that in mind, like, you don't have to go use any of these resources right away because you feel like you have to. Like, take your time and go to these resources when you need them, not because you think you need them, if that makes sense.
I think that makes a ton of sense. And I think that I thank you, both of you, for reminding families for that, because as I can sit here and say I'm in awe of these two wonderful ladies, that is very true, Bunny, is try not to compare your children to other people's children at any given day. I do it all the time with my little one. I'm like, she's behind in this and that, and I'm like, is it the cancer, or is it just her, or is it just what? And I think that actually is a tiny bit of normalcy in itself, because I feel like all families do that with or without cancer. And it is something that, sometimes I have to chuckle at myself, like, I'm making this about cancer, and maybe this isn't even about cancer. But that's where our heads go. And so I thank you guys for reminding us, though, to try to be as present as possible and cut yourself some slack because you deserve it.
And I think
So,
getting linked early is always a good point too. So getting linked with services that are available to you early. I know from the vocational part, you say as soon as they start talking about work, start feeding on that, starting seeing where that conversation goes. One of the benefits we say to, especially when we work with our transition students, is that we have like summer work experiences they can do where they're trying out work for the first time. So, and there's no risk to getting fired. So it's not they're being thrown out there into the fire and figuring it out the hard way. We actually get to immerse them in positions where they're in a working environment. They get to see how that affects them. Maybe if there's fatigue, if there's things, and there's no risk of being fired. And so they have someone who can be there, they can support and kind of help them learn how to work through those things where it doesn't affect their job record or anything. So starting working on those skills early as you're adjusting to your disability is always a good thing, I think, in terms of helping people adjust to it, how it may change later, and how to navigate that. So I know we always say, like, we started at age 14, which always seems really young, but you get better. The earlier you start, the better outcomes we usually see, because people are able to adjust and see how things change over time.
no, that is such a good point, Rora. Thank you. And I have been looking in the chat and monitoring as we have gone, and I am so happy to say that there have been so many wonderful comments in here of people agreeing and sharing their experiences and their stories, and so incredibly powerful. So thank you for those individuals that have done that. Our wonderful panel, there have been so many people that have given you shout outs and love. And so I hope that you guys go view that as well after this segment. Some of the questions that were asked, I am super pleased to say that we actually ended up getting to answer while we were just chatting. So thank you guys. That was awesome that we were able to do that, be proactive. I will say, though, that here in just a few minutes, we are going to move into our networking rooms. And in those networking rooms, we do have a transition room scheduled. So a lot of questions and dialogue can happen in there. Some of our panelists might actually be in those rooms. So feel free to engage with them there as well. But I honestly, as people